Somerville Community Health Agenda was actually born out of the Someville Hospital. It's been around for about 12 years now, and was the sort of outcome of a number of processes that Someville Hospital staff, physicians helped organize with, working with the Somerville Health Department to really look at together what are the most pressing health issues in a community and how to think about bringing together all of the forces in a community to work on and change those health outcomes. And so by looking at data, what we know is going on, and what we know is happening or in existence within the hospital, within the health department, we can, and community groups, we can forge alliances and actually sort of marshal our limited resources to make sure that we're actually impacting people's health. The Somerville Community Health Agenda came about as a way to actually have some people power behind trying to do this organization on an ongoing level, where we looked at the data and looked at the collaborative efforts that we could use to facilitate improving health. So one of the ways we do this historically is through health reports. So I have a collaborative report from 1994, which really outlined both the process and the product, the outcomes. What are the recommendations for addressing the health issues that come up when you look at the data? Most recently, last year we were able to launch the Wellbeing of Somerville Report 2011. And again, this was a collaborative effort that looked at a lot of health issues and brought together community groups, right, to look at, for instance, substance abuse, so that the organizations in the community who are dealing with those issues, like the Somerville Cares About Prevention at the health department, would bring together stakeholders. We would look at the information together and then figure out which information should be shared with the community, or needs to be, what's going on in terms of what strengths and assets do we have in a community, and then recommendations, and looking at some of the existing policy. We also looked at something that's sort of the root of a lot of health issues, which may not be heart disease or diabetes per se, but it's what's underlying why one person is more apt to get those diseases than others. And we looked at something called the social determinants of health. So we looked together at issues around poverty, housing, education, and how do those impact health. So some people might say, what is the hospital doing showing up at a meeting about early education? Well, we know that early education and continuing on through graduating from high school is a strong indicator of future health as an adult. So we do get involved, and we look at ways of trying to integrate the work that's going on at Somerville Hospital and CHA at large, as well as the local health departments. And now in Somerville and Everett and Malden and in Cambridge through the health department there, we are able to have positions like the Health Agenda who can really interface with bringing information from the community into the hospital and vice versa. So we can hope to improve communication and collaboration, because it really is about working together that we're going to impact health of our residents.
Hi, I'm Lisa Rocker. I'm the nurse manager of the Cambridge and Somerville Emergency Departments of Cambridge Health Alliance.
And I am Luis Lobon. I'm the chief of the emergency departments at Cambridge Hospital and Somerville Hospitals for the Cambridge Health Alliance. We'd like to take this opportunity to introduce to the Somerville community our emergency medical services at the Somerville Hospital. We have a fully functioning emergency department open 24/7 that is capable of handling any medical surgical emergency that could present in the community. Our staff is a single group of emergency medicine trained and board certified physicians and physician assistants that provide the same care at Cambridge and the Somerville emergency departments. We have put a lot of effort in the past few years in improving our waiting times and our door-to-provider times, and we can present the community with excellent times that are now being used nationally as benchmarks in emergency medicine. As far as our quality of care goes, the Somerville Emergency Department has been historically ranked in the upper 75th percentile according to patient satisfaction surveys across the state of Massachusetts, and sometimes achieving percentiles in the high 90s, close to 100.
We see a very diverse population here at the Somerville campus. We have one of the largest interpreter services provided so that we can see any patient that comes through the door. We either have a face-to-face interpreter within a matter of minutes, and or we can use the telephone in order to communicate with our patients. Nursing staff here are all certified emergency nurses. We take pride in utilizing best practices.
And that is very shortly followed up by a full medical evaluation. And in the case that you would require admission for inpatient services, we offer inpatient units at both the Whitton and Cambridge hospitals that can take care of any type of patients, medical or surgical, after the emergency medical evaluation.
I'm Dr. David Osler. I'm currently the SVP of Ambulatory Services for Cambridge Health Alliance. And I have the great luxury of having been in the Somerville community since 1974. As many of you know, I was the first board-certified pediatrician in the city of Somerville and started a pediatric service actually down in the medical building. Over the course of time, Someville Hospital was purchased by Cambridge Hospital, and I'm now in charge of all the ambulatory services for the Cambridge Health Alliance. What we've been able to do is while we've lost the ability to hospitalize patients here, we have a very robust outpatient services that really cover the gamut of care, from emergency services. We have large prenatal services. We have a state-of-the-art GI facility. We have a radiology suite that's above par excellence, and our primary care and our eye center are located in the Highland building, which is down right off Highland Avenue. The Somerville Hospital Primary Care was formed by consolidation of services in two sites within Somerville, one from Central Street and one that was here. Over the course of the last several months, the Somerville Hospital Primary Care has become awarded part of the Howard Medical School Primary Care Consortium and is one of the leading sites in that program. We also are connected to our other major campuses by an electronic medical record. And as well, we have several sites within the community that also provide primary care. Broadway Health Center, which is on 300 Broadway, and has actually almost 45,000 visits and is the largest site for the Cambridge Health Alliance for primary care. And then we have a teen health center, and we have a facility in Union Square Family Health. So I'm totally confident that we can provide primary care for you and your patient and your families. And we've done an excellent job cooperating and collaborating with the city during the years that I've been involved.
Hello, I'm Dr. Brian Green. I'm the medical director at Someville Hospital Primary Care, the clinic in Someville Hospital. We are a fully functional primary care center for adults. We have a number of things in addition to the primary care service one would expect. We have 2 geriatricians and a geriatric nurse who does house calls that connects us with the house calls program and helps us transition patients from coming into the clinics to moving into the house calls program, and also connects with elder services. We have a large number of behavioral health providers, so psychiatrists and therapists who are on site and help share seeing patients with us. We have a number of other important programs, part of the educational system. So we are a major teaching site for the residency program for Harvard Medical School's primary care residency. We have medical students who come from the third year of Harvard Medical School as part of their ongoing clinical curriculum, which is one of the innovative programs we've done here at the Cambridge Health Alliance. We have a full-service pharmacy program that manages patients who are on Coumadin or blood thinners, and also diabetes, and do some help with pain management. So this clinic is actually made up of two clinics that combined, one of which was the Internal Medicine Associates Clinic, and that was here at this building for many years. The other that I came from was on Central Street, as what used to be the old Central Hospital, but we had a primary care clinic there for about 15 years. That clinic and this clinic merged about 2 years ago. We have recently got a grant from Harvard Medical School as part of its innovations for primary care within the world that Harvard Medical School residents attend, and ours is one of the practices that they really feel like is transformative and will help set the future for primary care. So we are doing a lot of work to try and integrate the care we provide, and the term of art, what people are talking about in the medical world, is patient-centered medical homes, and we feel like we're doing a lot to get in that train and even lead the train. We have electronic medical records. We have ways for patients to communicate with us by the internet. We have a dermatology service that we don't have a dermatologist on site, but we have the ability to take pictures and get consultations from dermatology specialists within 24 to 48 hours. So I personally have been living in Somerville for over a decade. I've been practicing in Somerville for more than a decade. In fact, ever since I came here to do my residency. I have children who are attending schools here. I have a real attachment to the community, and when I'm not here, I'm serving on the Board of Health for the city as the chair of the city's Board of Health. So I think Somerville, I eat Somerville, I sleep Somerville. I'm here all the time.